Good
Okay, good
morning.
morning, everybody. For our weekly update, this is Edward Ng again with Pittsburgh Foundation. So as usual, if you would just go ahead and put your questions in the questions box, and we will email out responses after the webinar. This will be recorded, and we are going to be setting it up for rebroadcast. With that said, Mr. Koch.
Good morning, everyone. This is Phil Koch, Executive Director of the Community Foundation of Westmoreland County at the Pittsburgh Foundation, here with Dirk Mattson and Alyssa Chilodowski from the United Way, hosting our weekly call to make sure that our human services providers and those in the nonprofit sector have the most updated information to support our most vulnerable neighbors. I want to start by just pointing out this great piece of artwork that we have here that was provided this week by the Westmoreland Museum of American Art. What you're looking at is the view over Laurel Valley Golf Club and Route 711 South. The road can't be seen, but you can see the expansive view of the Laurel Highlands. Spring, as the painting was called, was painted by Bud Gibson, who actually was a professor at Penn State, New Ken, for over 30 years. It was painted back in 1993 and was part of a 4-part series called Seasons. So I just want to send a special thanks to the museum for sending us artwork. Always nice to incorporate a little culture into our work. So thank you. We're going to jump right into it. From the Community Foundation standpoint, I don't have a large number of updates. I know the one thing I want to mention is just a reminder that we do have masks that are available for our nonprofit workers and those that are serving the community. If that's something that you need, you can request up to 1,000 masks at a time. We just ask that you be mindful about how many you actually need. And just request what you need so we can make sure that we can spread those around as much as possible. Our first priority is to make sure that we have masks for those that are working in the nonprofit sector. Second priority is making sure that we have masks available for vulnerable populations that maybe are coming as clients to get some of those services. Maybe it's somebody that's showing up for food distribution, for example. That would be our sort of second tier priority. And then third tier is just general public. So if you keep that in mind as you make those requests to Bud Mertz and his team, you can find how to do that using the URL at the bottom of your screen, which takes you to the county site with all of the information that you'll find on these calls. Or after the call, you'll also receive an email from us just reminding with the resources and also reminding you how to do that. That's all I have from the Community Foundation standpoint. I'm going to go ahead and send it over to Dirk. Dirk first. Do you have anything, Dirk, for us today?
Yeah, I wanted to thank everybody that submitted data for the indicators on what direction this whole pandemic is going in terms of behavioral health and other human services. We've got a lot of the populations filled on it. One of the things that really jumps out so far with some of the information that maybe we haven't all heard about is the number of enrollments are up for MA, and that's just with behavioral health and drug and alcohol. The highest that is showing up on the chart is already happening in May. We got real-time data on that. It's about 2,000 more people have enrolled in MA than the next highest month. From what I see from the data, and for some months it's more. So that's a bit concerning, but not surprising. And there's other indicators on here, just like Deb and Jennifer have been saying with the food bank and feeding the spirit. Certainly the number of requests for food is up as well. But a lot of the other services are down just because people are afraid to go out and get them. So there's got to be some interpretation with these indicators as you read through it and understand really what the numbers mean with what's happening out there. So once I get all the populations filled, we're going to get it on the website so everybody can see it. When I say the website, the link to it is at the bottom of the PowerPoint where everybody can see. And if you want to if you want to get it from another direction, just go to the Westmoreland County Behavioral Health Developmental Services main page, and you'll see Human Service Network COVID on the left-hand column. Just click on it and you'll be able to see a lot of things that we've been putting there related to these phone calls and the pandemic. But very soon we'll have all this data on there. I'm hoping within the next week. That's all I got, Phil.
Great, thanks so much. Alyssa.
Yes, thanks and good morning. Similar to Dirk, we've been looking at our 211 data just to continue to monitor the types of calls and requests that are coming in. I took a quick look this morning. Just in the first 20 days of May, we've had over 700 calls. That's comparable to April when there was 1,200 total. So we can see the volume is still up. We continue at United Way to connect with our partner agencies to help as needed, making connections for them, and as we're able to provide some support. We still have our grocery shopping program going on. That's for older adults who are living at home or people with disabilities who are unable or cannot get out to the grocery store. We have volunteers who are going grocery shopping for them and delivering the food to their homes. All that information to contact is available on the website that Dirk mentioned. Please, if you know somebody who is in that situation, feel free to refer them to that phone number and we'll get them taken care of. United Way, we have our regional approach through Butler County, Allegheny County, Westmoreland, Fayette counties for food security, which has been one of the highest needs that we've seen. We're supporting our food banks and also the transportation of food. That's particularly in Allegheny County to some of the vulnerable populations. So as we're moving into what we, I guess, could kind of call a recovery type phase of this health crisis, I do want to say thanks to all of our agencies who've remained open, our shelters, food pantries, really, education programs and such that have helped really to support our vulnerable population and others as we have seen the needs arise. So thank you, and that's all I have.
Thanks, Alyssa, appreciate it. Bud Mertz from Public Safety, do you have a report for us today?
Yes, thank you, and good morning. The situation with the Westmoreland County Department of Public Safety is staying about the same status. It's hard to believe, but we've been working the COVID crisis now for 120 days. Since we started following it and bringing the awareness up to the level. Our Emergency Operations Center has been working virtually for 60 days. And so that's pretty crazy. You know, when you look at a normal disaster, and if you can call a disaster normal, you know, you might have a hurricane come in or a flood come in or whatever, and there's an end date, but you know, with this there isn't. So we're steady, staying strong and steady with our mission and objectives and our tactics to meet the mission as we go forward. You know, as we've seen the county switch from a red, basically isolation mandate to the yellow side where there's a bit more movement, we've noticed that our 911 calls are going up. You know, during the red phase, we've had I'd say that our 911 call average was down 30%, believe it or not. And you know, as things are increasing now, we can see that those call volumes are going back to normal. I don't know, a good sign or not, people dial 911 for emergencies, but yet, you know, that doesn't also mean people are trying to get back to their normal life, I guess. We still do all the data mining of the 911 calls so that we can, you know, produce intelligence, so to speak, actionable information that we can share with our partners. Is, you know, the main ones being the EMS side during the response, so we can still judge if there's any peaks or increases or anything like that. But also as we go into supporting the behavioral health side of this, as we, you know, do know that the secondary effects to this is going to be a huge recovery effort on the behavioral health side. We will be supporting the different entities that are out there that actually collaborate is probably the best word to use, to collaborate and share information that we can provide intelligence or actionable information to them to help monitor or judge these secondary effects. So we've been working closely with Dirk, and we're getting him some information of indicators as well. And we've met with the Community Action and Mandy from the Community Action, and we plan on supporting their biweekly calls that they have to be part of that as well, to give the public safety input from there. And so we, really want to stay strong with it, because you just can't respond to the disaster itself. The secondary effects have to be monitored and managed as well. And we will do whatever we can to support the entities in the county in doing so. One thing I do want to talk about, though, is the nursing homes. And I've been quite outspoken as far as how the Department of Health has been handling nursing homes. And back in the first part of April, I wrote a letter to Secretary Levine expressing some concerns I have that their playbook that they used was not really adequate and did not fit the local means as far as how to support that. We've been going back and forth. I've had many conversations with our legislative delegation, Senator Ward and Eric Nelson, and the county representatives as well. And they've pushed in some legislation based on some of our concerns. And yesterday I had a conversation with Eric Nelson and Representative Nelson, and who also mentioned even on the floor that we had some concerns and some bills that they're passing to address that. Last evening, I got a phone call from the Pennsylvania Emergency Management Agency and the Department of Health representative liaison that they had, and they've asked me to speak on a panel later on today about some of our concerns. So I think that's good. They're finally listening. In any disaster that you have, a two-way communications is vital, which we haven't truly had with the state. And hitting this point later on today with this meeting that I'll have with them, just anxious to go forward with that. So I'll be able to report out on that maybe the next meeting. But thank you again for the invite and me being able to share information on what we're doing.
Thanks a lot, Bud, and I appreciate I appreciate that you're jumping on to that biweekly call from Westmoreland Community Action for the providers meeting. That's really helpful. Glad your team's able to assist. Thank you. I want to go ahead and move on to Dr. Conway from the IU. Let's hear a little bit about our education sector.
All right. Good morning, everyone, and thank you for the opportunity. First and foremost, schools have begun talking and discussing what reopening in the fall is going to look like. There has been a ton of information coming from a lot of different sources, and districts are beginning to kind of filter through what they're going to be using for their own local decision making. We still are awaiting guidance from the PDE, which we're expecting probably sometime in the very near future. That's going to help provide kind of bumpers for districts to operate within when it comes to reopening schools in the fall and what that might look like. The intermediate unit is going to be sponsoring sharing forums next week for districts to come together and discuss different possible solutions, from safety, infrastructure, instruction, professional development, and things like that. So the intermediate unit's playing a role in bringing people together and discussing possible solutions for districts to make their local decisions. Secondly and lastly, just wanted to share that we did officially submit an application to the R.K. Mellon Foundation That application is really focused on providing devices, MiFis, as well as Chrome books for families within the county that need that access and assess educational opportunities, as well as an opportunity for teachers of early childhood, as well as early elementary grades to receive professional developments on how to instruct in a virtual setting, which we found was a big need within the county. Other than that, I appreciate the opportunity to share this morning. Thank you.
Thanks so much, Dr. Conway. Appreciate that. Let's hear from Jennifer Miller with the Westmoreland County Food Bank. Jennifer. Jennifer, I don't quite hear you. I'm not sure if your mic is.
I think we're good. Can you hear me now?
Yes, great.
Okay. Yeah, I was having some technical difficulties this morning. I was trying to actually be able to be on the webcam, but it didn't quite work out. So I apologize for that.
Good to hear your voice. No worries.
Okay. Things are going well here at the food bank. Things are starting to slow down a little bit in terms of the crisis. We've distributed since the beginning of all of this 1.2 million pounds of food, which is phenomenal for that time frame, and the lion's share of it came in April. We did about 10, since we spoke last, I should say, we did about 10 emergency boxes and 23 referrals to any of our pantry sites. That has gone down substantially since the very beginning of it all, when it was more like 30 or 40 emergency boxes a week or 50 referrals. So needless to say, it's starting to level off a little bit. And we're grateful for that. That it's showing signs of hope. So we're really pleased with that. The other thing that I did want to mention too is anytime you have a consumer that may be in need of emergency food, please have them contact the food bank, and we will make sure that we either refer them to an agency that's closest to them if transportation is an issue, or we will make sure that they get food no matter what. So if you just call the food bank at 724-468-8660, someone will get them whatever they need. If you feel as an agency you have a need for emergency food to have on hand, please contact us as well, and we can work it out if you're not already an agency. One thing that I did want to talk about is the Farmers to Families program that's coming up, also known as the COVID Farmers Assistance Program. The food bank will be distributing over the next, from now until October, we'll be distributing 11 times. The first one will be May 27th at the Westmoreland County Fairgrounds. We're going to be able to do 1,000 households per distribution. So after May 27th, we will be doing it twice a month. So we'll be able to serve 2,000 households. What they'll be receiving is a mixed dairy box, a fresh produce box, and possibly some meat products, possibly some beverages, things like that. And we're hoping to still get the Operation Barbecue Relief program. And if we do get that program by that time or during any time of these distributions, we'll be giving out frozen meals as well. And we'll be sharing some of those frozen meals with Feeding the Spirit for their Saturday distributions once we receive them. There's a little bit of a snafu with them, but hopefully that'll get on track here real soon. But this Farmers to Family program is a great program. We're going to be doing a good bit of PR, or attempting to do some PR around it. And it's for anyone. So if you eat, you qualify. It's just a great way to give some relief to the farmers and the producers right now, especially during this time when they're really having a difficult time. We're receiving no compensation for this program. United Way possibly will be assisting with some of our expenses, but it's more important for us to make sure that we're getting the food out to the people who need it, or the people who just desire to have some fresh produce and dairy products. So it is going to be a drive-through pantry. We're going to be bringing them through the fairgrounds parking lot into the main the main area of the fair and into the Rabbit building for those who are familiar with it. So it will be undercover if it should happen to be raining or anything like that. So the cars will still be driving through, but the food will be protected. So that was our biggest concern with doing outdoor distributions, is the rain with cardboard boxes. Needless to say, that's not a great combination. So we're hoping everything will go smoothly. We ask for everyone's patience as we go through this, because this is a first for us to do something of this magnitude. And as you know, I have not been a big proponent of these mass distributions. So we're just going to call them drive-through drive-through distributions. And hopefully it will go well and people will participate. And if anybody has any questions about them or anything like that, just give us a call and we'll be glad to answer those questions or get you to the person who needs to the best in knowledge of that. Other than that, I'm good. But thank you all for your support, and thank you for letting me give these reports. If you have any questions, my email is jennifer@westmorelandfoodbank.org if you want to direct them to me, other than on the website here. So thank you again.
Thanks so much, Jennifer. I appreciate your time. We're going to move on over to Deb Thackeray with Feeding the Spirit. Deb, how are the Saturdays going?
Oh, hi, Phil. Hi, everybody. Good morning. The Saturday meal distribution continues to go so smoothly, and it's really because of all the volunteers that come out and all the restaurants that contribute, but also it's because of all of the consumers that are coming. They understand about respecting social distance, wearing masks, and we've streamlined our drive-through as well and are expanding that and encouraging a lot of the consumers who have the ability to do the drive-through do that instead of having to stand and wait in line. So that has been working out really well. Each week it seems to get a little better. And the other thing is all of the consumers that come through are just so grateful. So we want to thank the restaurants, and we want to thank all our volunteers and all our partner agencies as well. We also have been getting a lot less requests for food, emergency food, which is a good sign, as Jennifer spoke about. And we're very happy to see that, because that seems to be leveling off. The same goes for emergency homeless placement. We've had a decrease in that. And when we do have that, we are working hand in hand with Welcome Home Shelter and Union Mission. And we all work together to get the people into a more permanent situation as fast as we can, especially in these times. So that's all been really good and positive, and there's a lot of hope. The other thing I'd like to mention is that we have been getting wonderful donations from various individuals and businesses, and everybody's very concerned about sustaining all of us in this time of need. So we did receive a lovely grant from the David and Marjorie Reese Family Charitable Fund, and it's of the Community Foundation of Westmoreland County. And this is specifically to be used for meal distribution and support the restaurants that are preparing the hot meals for us. And we were very, very happy to do that. So thank you all. That's about all I have right now. So thank you.
Great. Thanks so much, Deb. Appreciate it. We're going to move on now to Bobby Tanner from the Department of Behavioral Health and Developmental Services with the county. Bobby, are you with us?
Yes, I'm here. Can you hear?
Yep, go for it, Bobby. Thank you.
All right. Good morning, everyone. Hope everyone's well. So on Monday, May 18th, our office, in conjunction with Westmoreland Community Action, created and opened up our first responder COVID-19 support line. We've heard on this call for weeks between Dirk, yourself, Bud, and everyone else that we are aware that this is going to be a long-term psychological impact for individuals. One area that we thought that we can do our diligence on and step up is to help those who help others. We definitely want to take care of our first responders, ranging from your 911 dispatchers to your EMTs to your police, your corrections officers. So what this line essentially is for those frontline staff, those first responders who feel that they have a psychological impact. It's not just going to affect them now, but long term. They can call this hotline and talk to one of our staff on our CISM team, which is Critical Incident Stress Management. and that includes individuals from our Behavioral Health and Developmental Services Office, the Blackburn Center, SPHS, Torrance State Hospital, Excella, and Mental Health America. And our hopes with this is it's not just to only strengthen our relationship with our first responders, but also give them an outlet to talk to. We keep everything confidential, and if need be, we can refer them to many of our outpatient services if they need it in the long term. We're always looking to increase our CISM team with our first responders, so that's another reason we're hoping to help those who help others. And if anybody has any questions or would like a copy of this flyer, you can feel free to contact me. And I know that I had also forwarded it to Dirk as well, and he can get that out to everyone. Thank you.
I think we got it on the website, but I'll double check that. But if it's not on there, we'll get it on there very soon.
Yeah, we had worked with staff over at the 911 center and asked them what they feel that their needs might be. And we understand that, you know, they have different needs than most people, and they're stoic by nature, but we definitely want to let them know that, hey, we are here to help. If you need an ear to listen, we'll absolutely do what we can to assist you. You know, we're thankful for everything that you folks do.
Great. Thanks so much, Bobby. I appreciate it.
Thank you.
Yeah. Now we're going to move on to Carrie and Cheryl, who are here from the Westmoreland County Housing Authority. Are you all with us today? You might have to unmute your phone.
Hi, Phil. It's Carrie Lukash from the Housing Authority.
Hey, Carrie, glad you're here with us.
Thank you. Cheryl and I talk about different programs. We both work with different housing programs here at the Housing Authority. So I'm just going to start and just give you a little bit of information about what's been going on here at the Housing Authority. We have been open. We're not having tenants come into our building at this time since the beginning. We've been doing phone calls, emails, faxes for applications. We've had drop-off pickups in our lobby. So we've had a lot of communication with our residents, you know, just trying to get our paperwork done and do as much as we can and to help them and answer their questions. You can check our website. We have some HUD updates. We've put some HUD brochures on our website just about what's going on. There is a moratorium on paying rent until July 25th. So, you know, no one can be evicted until that time, but we are still encouraging our residents that they have to pay their rent. So it's not going to be forgiven. If you haven't had an interruption in income, you still need to pay your rent. I feel that with my program, I supervise the rent assistance program, and we help people who are homeless or being evicted. People who are living with friends and family, lost their income. I feel that we're going to have a big increase in August once the moratorium is lifted. So we're trying to prepare for that. We also have emergency solutions grant money that we help people with rent arrearages. We're also applying for funds through the county and Union Mission to get additional funds for COVID. People that were affected by COVID-19 had a loss of income or lost their job. So we're working to try to help people, writing up some guidelines. Normally our HAP program, you have to have income. Like if we help you to get caught up with your rent, you have to show that you're able to pay your rent once you get caught up. We're trying to work with our residents to do like screenshots if they got the stimulus money or unemployment. We want to try to help them to get caught up, and then once they start employment again or go back to work, we want to help them stabilize their housing and stabilize their family. So we're working to do what we can with our funding to help people. We've also applied for funds through the Pittsburgh Foundation. We do have some money to help with people that have gone behind with their rent. So we have certain guidelines. We're going to try to help people, families that have felt the impact of the homeschooling and still have to go to work or childcare. So we're looking to help people. We have a nice amount of funds from the Pittsburgh Foundation. I think that's about all that I have with our rent assistance programs. We do have a Hope and Life program in our public housing communities. We have service coordinators that work with our residents to help answer questions. We are, we're doing social distancing, wearing masks, but a lot of our residents have questions and concerns. So I know they're doing a lot of referrals. They're, talking with people, trying to work with them just to help them keep their rent paid and just to give them different referrals and just different sources of other services that they may need, whether it's mental health, drug and alcohol. We are trying to work with our residents and help them in any way that we can. So I'm going to turn it over to Cheryl. She can talk a little bit about our Section 8 and public housing programs.
Thank you. I work a lot with public housing and Section 8, mainly through the Family Self-Sufficiency Program. But right now, both public housing and Section 8 tenants still have the same memorandum as everybody else. They don't have to pay their rent until July 25th. We're working with them closely, or trying to work with them on money management, because if they leave their rent go until July 25th, it's due. So we're working on ways that they can manage their money. They're getting stimulus money. Some are getting extra unemployment and that. We're trying to work with them on managing their money so that they're not in a dire situation come July. We're going to connect them with resources. We've posted some on the FSS page and on the resource page and the Section 8 page. We've provided them with unemployment information. We're doing budgeting, of course, with any client that's open to that. Yesterday, even though you can't see me today, I used my cell phone and we Zoomed with a group of 10 tenants that have been doing an educational workshop, building your financial house. And I'm very pleased, everybody connected. We had a 2-hour meeting. It went so well. So we're trying to reach out and continue some of the programming we already have. Reach out and educate them and keep them aware of what to do with the limited resources they have and prioritizing and that type of thing. We're really trying to work with the tenants. Section 8 in public housing, the managers are operating on so many days at home, so many in the office. We're still processing, and that they're just not having as much personal contact, of course, with the clients, but we are trying to prepare them for when things are getting back to normal as far as resources and that. We're working with our clients on the employment end and connecting them with the resources. That's pretty much what we're doing different at this time. And that's not really different. We're just using different means to do it. More mailings, more resources on the web, those type of things. We are right now concerned mostly about people who are getting paid and are getting money and are working, leaving their rent go. And then all of a sudden, come July 25th or whatever, rent's due. We don't want to see any type of housing crisis with our tenants. We are also at this time working with Caesar from Westmoreland Library and Dave Civic from Computer Reach on actually a museum and library grant to get some iPads. Actually, it could be as much as 325 iPads into tenants' hands so that they have more communication and access to resources and that from right there in their homes. So we are working on that, and hopefully when we apply, actually the library will apply, hopefully that will be approved. That is under the CARES money. So it's part of the CARES funding that's available. So we're hoping to do that. We had done some of that in the past on our own with money we got from different sources, and it was very successful, and the elderly really enjoyed being able to connect to things in their home and learn how to use it, because we did some teaching with it also. That's kind of what we're doing. We're just trying to stay as connected as we can to the tenants. That's all I have. Thank you.
Yeah, thank you for inviting us. And if anyone has any housing questions, they can call the Housing Authority, 724-832-7248. And my extension is 3029 and Cheryl's is 3048. If we can't answer your questions, we'll connect you to the person that can.
Great. And as always, when we send out the follow-up email, we'll be sure to include that contact information for those that may have missed it. So we'll write that. We'll get that sent out to everyone. Thanks, Carrie. Thanks, Cheryl. Appreciate your time.
Thank you.
Our last speaker today is Dan Carney from Union Mission. Talk about housing, a little more on housing and homeless. Dan, are you with us?
I'm here.
Great. Go for it.
I appreciate the opportunity to speak. A couple of things that I'll start with is those folks in our community who might be familiar with coordinated entry and the processes around coordinated entry, which is the kind of streamlined approach for households experiencing homelessness in our community and navigation and connection to resources and referrals. We're in the process of going through a significant upgrade in that system that requires some additional training and new assessment tools. And so for our providers that are referring into that, those referrals will continue to function the same way. You can connect through the shelter programs or by calling 211 and have folks be able to connect to that system. But we do expect that there'll be a small 1 to 2 week delay as we're all onboarding into this new system in terms of being able to navigate. We're losing a lot of our customizations and inbuilt options within the software package. So bear with us through that time. And when we started to look at some of the information and data relative to that system, so coordinated entry being that place where we're able to look at category 1 and category 4 literal homeless, definition of homelessness, and those that are actively fleeing domestic violence, the data trends have shown that through January through March, there was a small decline in the number of assistants, but that number is since April kind of returned to normal for people reaching out. And we wanted to kind of share some information about the successes that we're still seeing in that housing field. So from Welcome Home, from April 1st until Wednesday this week, they've had 13 calls for family. 4 of those were fleeing domestic violence. 4 were from out of the county, and they had 5 that were admitted that didn't show up at the shelter. And then we're able to connect 2 of those families to a hotel that Feeding the Spirit was helping with. And there were 20 single female calls, with 5 being admitted to the shelter, 4 who were admitted but didn't show up, 2 being from the out of the county and 1 from out of the state. The other callers that they had gotten didn't meet that literal homeless definition. But more important is the success that they're having in moving people out. And just this month alone, there are other programs that Connect operates in our community. We're able to successfully place 8 folks into permanent supportive housing, which is really a critical component in our housing interventions. And being able to move those 8 folks that have extreme vulnerabilities and really need the stabilization offered in permanent supportive housing was key. Looking at Blackburn Center, who continues to operate and provide housing and counseling and supports for individuals and families who are needing to flee domestic violence, human trafficking, stalking, dating violence, all of those kind of categories. From April 1 to today, they've had 6 adult clients who went into housing, and 4 of which were mothers. And so they were able to provide housing for 6 adult women and 11 children, moving them through the system and back out to housing just this last month. Union Mission, from April to now, had 25 calls. We worked with 50 people through housing, those that were in the shelter beginning in April 1, plus those 25 that had called in. And we had 27 folks exiting the shelter, 7 going to family and friends, 1 to a halfway house, 1 for long-term drug and alcohol treatment. We had 1 leave for a shelter program in New York, PA, because he found employment there, and 10 who transitioned into independent living. The others either left without notice or refused to tell us where they were going. And the rapid rehousing program that also serves was able to move 8 people this past month into housing with referrals from Blackburn Center, Feeding the Spirit, and the other shelters through coordinated entry. And I say all that, it's a lot of data, I know, but the intention is to say that the shelter programs are up and running and still connecting people to permanent housing options. Those supported housing interventions are still up and running and connecting people to housing. And we know that, as Carrie shared, the housing authorities programs are still up and running and have been a vital part of some of those connections to housing for people. So we just encourage you, as you deal with people who are experiencing sometimes unique housing situations, to have them reach out through 211 to get connected to a coordinated entry assessment center who will be able to start looking at all the scope of services and what they might need, especially as we prepare for when the moratoriums will lift. So I just want to shout out to everybody for all their hard work across all the basic needs providers, and thank you for the opportunity to share.
Great. Thank you so much, Dan. Appreciate that update. Well, we've come to the end of our speakers for today, I believe. Before we sign off, Dirk, is there anything that you have that was missed, or Alyssa?
Nothing from me. Thanks, Phil.
Great. Dirk?
Just to mention that we're going to do these calls weekly up until next week. Next week's our last call. And from there, Phil and Alyssa and I've got to get together and make a decision on how to handle it from that point on. So I just wanted to say that as a reminder to everybody. Next week will be our last scheduled call that we have on the calendar.
You took the words out of my mouth, Dirk. So we will we'll make sure we communicate to everybody how we're going to move, how we'll process moving forward, whether it's once a month or every other week. We might do some surveying of some of our providers to see what might be helpful. So because we're here to be of service to those that are on the front lines. So thank you all very much. If there's anything that you need or any questions that you have, feel free to reach out to me or to Dirk, to Alyssa, here to help. Have a great week. Thank you so much.